Good evening, everybody. What it takes to cross a border, not just a map, but it's in our mind, your career, your identity. Welcome to Podcast Synergy of Roots and Wings, where we explore how staying grounded give us the courage to fly. I, Dr. Manali Mehta, the organizing secretary for Bharat Dental Show, and Dr. Saloni Mistry, the organizing chairperson, are the moderators for today.
So, hello. This has been something which is very unique, and we wanted to blend this in the theme that we have created for the May webinars, which was Roots and Wings, celebrating global Indian voices abroad. Apart from the traditional Wiser Wednesdays that we went through in this entire month of May, the culmination of the entire month of May was a podcast synergy of all those globally Indian women who are rooted still in India, but they have kind of made a niche abroad as well. And today we have Dr. Diksha, who has been such a dear friend, as well as somebody whom I have been knowing since she was a little girl, I guess so. And to add a little more emotion to this podcast synergy, both Dr. Diksha as well as Dr. Manali have been students of my mother, late Dr. Aruna Mehta. So it's so nice to have all three of us on board today with that touch of emotion and mom blessing us. Over to you, Manali.
Thank you, Saloni. Me and Diksha, both of us would agree that Mehta ma'am has been very instrumental in what we are today. She would be really proud of both of us as well as you. And seeing all three of us together would be like amazing today.
What Absolutely. A moment.
Yes. So for the podcast today, borders can be physical, cultural, or professional. They define us, but they also confine us. Today's guest, that is Dr. Diksha, has lived the tension of honoring her roots while building wings strong enough to carry across those lines. Her story is about identity, resilience, and the courage to redefine home. Today, we are talking about what it means to cross borders in skill, in geography, in mindset, and still stay rooted in purpose. And we have a perfect person to guide us today. It's my privilege to introduce someone whom I have known for more than 16 years, Dr. Diksha Tahilramani Batra. Dr. Diksha is an internationally trained prosthodontist, fellow of FICOI, with training from Zurich, UCLA, UCSF, and NYU. She's a principal dentist at the Pain Free Dentist, founder of Smile Essentials, one of the Mumbai's top 3 clinics, co-founder of Angel Dentist Network, it's an NGO. She won the Best Implantologist in Mumbai 2019. She was a keynote speaker at the World Dental Show 2019 and has pioneered the pain-free dentistry in India. I have known her for 16 years. She's crossed every border of skill and geography to make dentistry pain-free. In 16 years of knowing her, I have watched her cross every border of technology, fear, access, and expectations while staying deeply rooted in service. That's what crossing borders really means. Dr. Diksha, thank you for crossing a few more borders with us today.
Thank you so much. That was a humbling introduction. Thank you, Manali. And right back at you for being an amazing, inspiring senior, right from college to right up to now, what you all are doing with this. And thank you, Dr. Saloni, because my connection with you and your family across 3 generations is truly very special. So thank you for having me.
Great. So would you formally introduce yourself, Dr. Diksha?
Yes, of course. And I'd like to keep this introduction, especially for those women who are probably thinking of, crossing borders or even redefining themselves, because the journey across borders is really about reinventing yourself. You don't really have to cross a border physically to reinvent or redefine yourself. And for me, this journey has been amazing only because it's really questioning and starting to challenge yourself at so many levels. You tend to get complacent after a couple of years of practice. So this has been getting that energy back as though you've just started out again. So that's what it's been for me. My journey across dentistry has been spanning 17 years now. And it may have started with a foray into prosthodontics and implantology, which is essentially what I do on a day-to-day basis. But it went far deeper in trying to manage pain for patients, which I feel very passionately about, because that's one of the biggest fears or barriers to receiving dental care. And it also, I've been fortunate enough to serve the needy with my organization, Angel Dentist Network. And I've also forayed into mentoring younger students with Rise University, which is my initiative. So it's been a very truly rewarding journey with different aspects of dentistry really coming together for me.
Perfect, Diksha.
Very commendable to be into playing so many roles together. Not only in the field of dentistry, but running an NGO and also having an excellent work-life balance.
Absolutely.
I'm sure it was not an easy journey for you to do what you are doing today.
But that's what women do. I think the women wear so many hats so effortlessly, and that's what's inspiring to see. And that's why I love what y'all are doing with Bharat Dental Show, bringing so many women together and, upskilling them to actually be able to do more and be actually seen with what they're doing.
And you're a part of us.
Yes.
Thank you.
What we are doing, it's not just only me and you, but all of us
Absolutely.
Doing it together.
Absolutely.
Absolutely. Thank you for having me.
So what is that one thing in your Indian BDS or your MDS training that prepared you for practicing abroad?
I think if you say academically, it's just the vast amount of clinical exposure that we have, right? The number of patients we see, which gives you the confidence to be able to diagnose well, to gives you the confidence to actually be able to do procedures effortlessly just by the sheer number that we have done. I think one distinct difference we would say is with or without technology, we are able to deliver good dentistry. Having the additional benefit of the latest cutting edge technology only makes you even better at what you do. But the core foundation was laid with hours and hours of practice and the sheer numbers of clinical patients that we've seen.
So when we are talking about crossing borders, what was the first major border that you crossed that changed you? Like in terms of, crossing the border and going from India and crossing the border. What is that first border that changed you?
The first mental border.
Yes.
Yeah, it was a mindset or the expectation. What was it, that first thing that which was like you had to break that?
So, when you're standing, like when you leave your country and your comfort zone and you step away from people who know you, because when we start our practices, it's, usually friends, family, people you've known who anyways come with some amount of trust to you. So half the battle is won right there. But when you come into an absolutely new place where nobody knows you, nobody knows your previous credentials, nobody's seen you, collect all those accolades, you are literally stripped away of any past experience, recognition, awards, anything that used to define you. And you're starting as who you are as a person and you're building that all back up. So I think that just the identity of who you become over 17 years of dentistry, you take for granted. But when you have to reintroduce yourself to that first patient or to that first doctor who you want to go and get a job with, it is humbling. It is humbling. It's like going from 40 to 20 again. But it's, I think, the most highly recommended experience, I would say, to invigorate yourself again. And so that's one where you really start defining yourself again in a very simple way. The second thing I feel is when you're standing on a global stage with people from different nationalities, different backgrounds, different cultural, sort of interpretations, you don't take the small things for granted. You really have to get across to them at a emotional level more than even a verbal level, which I think was a real educational experience for me, right? Because you would assume that certain dentists would be better than you, or certain patients you would not be able to break across because of, say, language barriers or cultural differences. But when you start doing that, it's a very different confidence level that you build, because like dentistry literally has no language other than that of gentle, pain-free care is how I've seen it. So
That's
if
so
you're really good at
wonderful.
what,
Yes, very, very nice.
so if it doesn't matter the color of your skin, it doesn't matter the years of experience, it's just what you can actually deliver with your hands. That patient will be able to tell you even if they can't speak one word of your language. So you get that feedback almost instantaneously at a very intuitive level.
So with that about patient expectations, I would say, how does it differ across the cultures and the healthcare systems that you have experienced? Like between when you are here in India and now when you are there in Dubai, how does it differ? The patient expectations on those topics.
So it all depends on the demographic of patients you're treating. Of course, there will always be the masses here as well, and there will be the absolute elite here. But as a general median, I would say that patients in India would come in more for pain. And this is just my experience, where if somebody has a problem, they'll only go to the dentist then.
True.
And this is something we've seen across the board, whether you're in Bombay or you're in a smaller city or in a bigger city. The real cultural sort of understanding of dentistry has been for us Indians that why go when there's no issue, right? Like most of us think like that.
Yeah.
Maybe me included as well, that if there's pain, then that translates to a dental visit. But here patients are extremely aware and maybe more self-conscious, which is why we do see the rounds of like a third round of veneers being done just because something wasn't perfect. So the level of self awareness is really high here. And even one of the biggest shocks that I saw with my patients was that the decay rate is so much lesser. So like, in my previous practice, 2-3 cavities are a given, right? When a patient comes in for a checkup or like some little perio issue or some previous dental work which needs servicing, you will see clean mouths here for a lot of people, and which have been really well looked after, right? From hygiene to the standard of restorations that they opt for and then maintain. So of course, this is not a generalization, but this was just that first stark difference that you saw, that you will not find, say, 5 class 2s in a mouth.
Yep.
So that's something that you have to sort of mentally prepare yourself with. So you're happy to see that there is an awareness, but you also have to then redefine your role as a care provider, right? Then you're not going to be hopping about the awareness which is already there. You have to elevate yourself to the next level and try and understand what is the problem they're facing. If it's not just dental pain, then where's the gap?
Yeah, so that's where I'm going to ask you
Yeah.
that elevate your level.
Exactly.
What is it that you have probably worked on yourself to elevate that level? Because now it's not about treating cavities. That's what we've been probably doing here back in India, because the dental health awareness still needs to be upgraded a lot. So when you cross borders, you understand that you have to probably cater to a completely different type of patient expectation. So how did you elevate your level?
So I feel like in terms of the elevation, it has been an absolutely satisfying journey, at least so far. I'm still young in the game because it's been 2 years since I have come in. But what I'm seeing in terms of dentistry in Dubai is that a whole other level of standard of care is provided, where rubber dam is the norm, where amazing clinical photography is just routine, where really good case presentations are the way that people communicate with their patients, and it's almost something that people expect, which is why when you're practicing in the backyard of some of the biggest dentists that the world has seen, you tend to hold yourself to that higher standard, right? So it's kind of like where a patient would otherwise come in for a routine procedure, not know what's happening in the mouth. Here the patient receives an entire overall sort of a health plan towards their teeth, which is extremely visual. So for them to be able to track and trace, and with AI coming in, there are parts of that also we are seeing which are getting automated for the patient to then maintain this as a record for themselves and even take up a big responsibility in their own health care, in their dental health as a responsibility. So I feel like these are some of the things that in a busy practice I would have ignored. But because the way people look at dentistry here is slower, more quality, and again, I'm saying it's not a generalization to every practice in Dubai, but this is some of the things I've experienced, and I have probably opted for them because it's a difference from it's where I wanted to go in my journey as a dentist. But there is tremendous opportunity to really hone your skills as a dentist and be extremely precise with the work you do, as well as look at aesthetics in a very different way. The labs here also have like profound skills where the product you're delivering is so much better, even if you as a dentist are still the same, but then you're getting such good lab support that it really elevates the final result.
Okay. So what are the what are the few things that you would actually want people back here that you've already inculcated in your practice in Dubai? They should be like taking it forward.
And one more thing is, what licensure exams, that you need to give? Because, see, that's very, very important, because when we are planning to, cross borders, then being in Dubai, what is it that you prepared yourself, giving a licensure exam, and then you're getting into dental practice, and obviously then you're going to, flourish in your dental practice. So could
Absolutely.
you please, tell all our viewers of what is it that you did?
So initially, anyone who comes in here will look at definitely getting a licensed exam, which basically has two parts. Getting a license has two parts. One is a clinical MCQ based exam that you will give, and the second is going through a process called data flow, where they backtrack, check all your credentials, and then sort of qualify you to go to the next level. So basically what ends up happening is, if you are a general dentist, you will go for the general exam. If you are a specialist, then you will try and go in for your specialist exam so that you're directly licensed to practice your specialty. And both these processes go hand in hand. For someone who is, say, self-employed, data flow would take a little longer. But for someone who's already been employed and can have the paperwork to show, then that becomes a quicker process for them. The exams are challenging, so you have to go back and read everything and do a lot of practice sets to be able to answer, because it's all application based exams. So it's not just theory, but it's how you apply it to clinical, where I think these many years of practice then really helped me to correlate the questions and sort of understand clinically. So when someone comes in straight fresh from BDS, it might be a bit harder to have that clinical nuance read in the exam, and that's why maybe you might have to give it a couple of times, which is okay, but the right training can get you there. Yes. And what I have seen is, for a fresh graduate here, getting a job is really hard. In general, the job market is competitive, as we see even, let's say, in Mumbai or cities like that. It's not cakewalk anywhere, but at the same, you need to differentiate yourself. So what I would probably recommend to anyone who's watching and is looking to get an opportunity here is a couple of years of work experience, whether as a BDS or even as an MDS, will really set you up for a better, sort of application process here. And a lot of people even go in and do the exam in India itself, so that they don't have to come here and bear the cost of living without a solid, job prospect. So that might be
possible to give the exam in Dubai. I mean, give the exam in India. That's what you mentioned.
Yes, absolutely. There are lots of exam centers in India, and that might be a more strategic decision. So you can actually give the exam, clear it there, apply for a job, and only come in when you have something more confirmed. And
do you have any institutes or somebody who is training you for doing the same?
Usually, the DHA portals itself provide you with some study materials. Prometric exams also have some study materials, but there are websites like edental.com and things like that, which will give you a lot of practice sessions. Not that I'm affiliated or collaborating with anybody, but these are some of the resources that I ended up using. And it's down to our basic dentistry, but at an application level, at least for the prosto exam. So this is something that you would definitely benefit from. For the general dental courses, there are some people who do coaching that I came across, but I'm not sure how authentic those are. You'll still have to go through your, rigorous self-learning, all of that. But one thing I do see is that clearing the exam is one part of the story, clearing the data flow is another part of the story. But differentiating yourself in a market where there is a flood of dentists globally, as an Indian dentist, how do you differentiate yourself? And one of the things that really opened doors for me was social media, where if you have a consistent brand and a consistent identity on social media, you will be able to impress people, because you have a following, you have a way of communicating, you have a way of building awareness, and they can see your CV in action, basically. So for all young dentists or old dentists, I would say at the end of the day, we are at this brink of, the last edge where you cannot survive without social media. Now, whether you choose to make your content playful and crazy, or whether you make it deep and intellectual, that's a choice that I leave to them. But this is something that I would recommend everybody needs to be in it. You have to wet your fingers or get completely immersed. That's up to you, but it's not an option anymore. And when we're sitting at the brink of an AI revolution, social media will tomorrow be a thing of the past. Like now, we have to get to the level of being able to use AI in everything we do. So that's something I highly recommend. And Dubai will see you in a better light, whether it's dentistry or anything else, if you are good at presenting yourself well and communicating yourself well, because this is a place where people are really self-conscious. So, putting your best foot forward will come from presenting very well. Yes. Presenting both clinically as well as on social. Both those things I think have taken me a very long way here. And it definitely adds to your repertoire of skills. So you'll never regret or never go back, once you've started doing these things.
I guess so. That's true. Because that's what we were like almost, myself and Manali, when we were talking about this podcast. And we thought that every single time when we conclude the podcast, we ask you this one question. How do you stay still rooted to India, number one? And what is it that you would tell the younger generation or your younger self? What would you give that one advice that is very important, being rooted to your grounds in India, however, to still keep flying?
Amazing. So I think I have at least two messages to give here. One, I feel like if you're going to cross borders or even transition in your career, wherever you are, if you're going to take this journey of redefining yourself, then you have to learn to be patient. And this is something I struggled with, where I expected to land here and then expected things to happen overnight. That usually doesn't happen. And at this age and stage, you have to learn to allow things to come to you. Be patient, it'll definitely come, but you have to learn to pace yourself. There will be times when things just work out and open up, and there will be times where you have to keep, your faith and have to be resilient. Because when you're choosing to step out of your comfort zone, the journey is not going to be linear. It's going to be full of ups and downs, and you chose it. And maybe that's more exciting as well, right? So when you are taking that step across, then welcome the unknown a little bit. We're all in that, we all want to control everything around us, especially as women. So that little bit of losing control is okay. I've taught myself that over these last 2 years. And I think even for being rooted in my cause and in my country, I think nothing has changed for me because I'm still dealing with a lot of Indian patients. So for me, it feels like a home away from home. And I've been lucky that Dubai is so close and so full of Indians, so full of my community of Sindhis as well, that I quite enjoy the every conversation can end in Hindi. And, so I don't really feel alienated. But for a lot of us who are maybe in America or the US or are thinking of taking a leap into lands where maybe India becomes a far distant dream, you will definitely feel homesick. But there are these things that we bring to the table, which is extreme resilience, hard work, and a lot of clinical experience, which I think you should hold with great pride and confidence, because as dentists, we always are solid products, is my experience from everyone I've met. Some of the things that we do want to focus on to showcase better is definitely our presentation skills, maybe our way of showcasing our work like photography, rubber dam, elevating dentistry to a level where we are proud to show it on, let's say, a huge stage. Those are the things I think we maybe miss out on. So to all my Indian fellow dentists, whether it's men or women, at the end of the day, let's sort of put our best foot forward and really work on ourselves to put up a great show on the global stage.
Thank you so much, Diksha. That was amazing. Like the insight that you have given us today about crossing borders and still being rooted, it says a lot. Your story proves that roots don't hold us back. They point us forward. And the wings aren't about escaping. They're about carrying who you are into the new skies. Thank you for showing us that crossing borders, what can really mean. To our listeners.
And yes. So continue, and then I'm going to just say one thing which I learned from Diksha today, which I'm going to conclude with. Yes, Manali?
Yeah, and to our listeners, what borders are you being invited to cross and what route will you take with you? So stay tuned for our next podcast of Roots and Wings and many more conversations with many more Indian women who are globally situated.
And let your faith be deeper than your fear of crossing borders, but still being rooted to India. Thank you so much, Dr. Diksha. It was so wonderful connecting back with you. Absolutely. And yes, you are a part of us, Bharat Dental Show. So we are growing globally and you are connected to India by being connected to Bharat Dental Show. Thank you so much.
Thank you so much.
Thank you, Diksha. Pleasure meeting you, and we stay connected.
Absolutely. Thank you. And it's been a pleasure to share the stage with two amazing women like you. Thank you so much.
Thank you.